Washington State will partner with Kaiser Permanente to get a series of vaccine clinics, especially for teachers, ready to go. The details are still being worked out, but they'd likely be inside Kaiser facilities, and there could be as many as 5 different locations in Spokane County. They haven't yet worked out how they'll verify that folks are in fact school employees. That and many other logistics will be figured out in the coming weeks. State Superintendent Chris Rakedahl said today it'll likely be 5 or 6 weeks before most teachers become eligible for the shot.
But definitely getting us launch ready on day one when we get the green light so that we are more efficient when that happens, so that we can get all of our employees vaccinated this spring and candidly to get schools open.
For many teachers, knowing there's a strategy to avoid chaos is a big relief.
I love that the superintendent has a plan that when vaccinations get here, we will have a streamlined, good, clear plan of how to execute getting shots in arms. And we see how complicated it is.
But it's also important to note this won't be the only option for teachers. Other providers will still exist. In fact, Spokane Public Schools and the Health District are also working on their own plan. That's part of why the local union president said today's announcement, while nice, isn't all that thrilling.
Locally, I think we're disappointed that there's not more clarity about the plan and that there's not more vaccines for us. I think the hope, at least from our end, was that there would be more vaccines available and that we'd hear about getting them sooner.
Rakedahl also said that we can't wait around for the vaccine to continue with reopening.
The bottom line is a vaccine is a tremendous safety net, but it is never the thing that's going to create the perfect scenario. Our schools are safe today when they follow the protocols and opening.
So I think he understated how important the vaccines are. We want our staff to have access to them. That isn't to say social distancing and masks and those other things aren't effective, but we've always been about what is the safest way to get people back, and vaccines are one of those things. So,
Casey Decker, KREM 2 News.